One of the questions that I get at every practice, I see it as an issue in the practice I still work in. And I think we can separate those two issues because they are a little bit different and bring a different level of frustration when we talk about attendance, actually being there for your shift, and punctuality, which obviously means being there on time. And I think, again, I'm going to bring it back to your attendance and your punctuality policy in your employee handbook. If the expectation is that your shift starts at 8 o'clock, that means in the door, clocked in, on the floor, ready to go at 8. It doesn't mean walking through the door, putting your stuff in the locker, eating your breakfast, doing whatever it is you need to do, and actually being ready to lend a hand at 8:15. And I think what we forget is that there's somebody waiting for us in many cases. It's a client waiting, it's a team member waiting, and we can't do that. I mean, I just recently had an experience in the practice where we had a client bring their pet in for a urinalysis. What do we tell them before they come in for urinalysis? Don't let them pee. And they brought the dog in. We brought it to the back. The 8 o'clock technician was late, and she was only 5 minutes late. But 5 minutes is a long time for a dog that has to urinate and a client that's waiting. And so I had to leave my workstation to go and help the technician get the urine because I didn't want the client to wait and I didn't want the dog to be in pain or uncomfortable. And that was, I mean, 5 minutes might not seem like a lot, but it is when you have a client at the end of that wait time or a patient or a team member.